this on her 5 minutes and have her do exercises the rest of the time.
So why don't you bring a chair?
You might want it maybe 15.
Sure.
Have her do a little bit of exercises and then 15 cold. So that is up to you. That's something you're gonna gather as you go on. But 5 to 10 minutes
Look, I
is
want to show
the
you.
basic.
Oh, they cleaned it up.
And then
10
now
minutes usually, right?
Too bad they
Yeah,
cleaned it up.
so cervical, you have different shapes. So the cervical obviously is going to be for your neck.
Open this up.
And then I think there is smaller
I'm
parts there
gonna give you
too.
a tough
There's
job.
like a smaller one.
Hold this.
If you have a smaller area, if you're not going exactly to the full back, if you want to do half of the back,
And
you use a smaller one. And it's the same protection, you need the same amount of layers,
Turn this machine on.
and the treatment is going to be about the
Everybody see
same,
it?
between 5 and 10 minutes.
If Marisol was to let go of that to
temperature
place
that gets
the
rid of.
patient's hand in
After
here,
10
what do you think will
minutes,
happen?
the tissue is really
Don't do
warm.
it. What do you think will
So
happen?
normally if you do it 20 minutes.
This stuff is gonna blow all over the
they do that
place.
in reality.
Do you think that's something we want to do?
But you have,
So,
the first
the
10
key-
minutes is the
the key,
maximum
we talked about the
temperature
theory, you
that
guys
is
already
your
know the theory,
skin,
now the
and the next
application.
10 minutes are it's
There are
maintained.
Two
And
things
after
that you
that,
need to think about as
there's
it
the more heat.
pertains to the application of this machine.
So
Number one, mostly used for
the,
hands. Right?
the
Hands.
cervical is going to
Constant
need the same
heat.
protection. We can use
Hands,
towels,
constant heat.
and you just
And
put
then-
towels on the
and then,
back, and then
if I am gonna
you
place
apply.
the patient's hand in
Like
here,
So
I have to have the machine.
same level of
same layers,
Oh,
yes.
same
So if you can remember the
When
things
you're
I told
going,
you,
when you're putting something
Yeah,
on
remember to have the
someone's
machine up.
neck
Now,
or
Marisol, you
cervical
remember
area,
this
do they
before?
tend to sit up usually
Sure.
or lay
They
down?
can be sitting.
Sitting?
Sitting is better usually.
would you place
Do
your
you,
hand in
do
there?
you actually
If
use
you-
the Velcro?
If you're down, not really. They don't really use them. You see them with the Velcro.
No, not at all.
I do it because most
So
of my
it won't fall off?
most of my
Sometimes-
patients lay down, so I do it. I wrap it around.
Because
But
I've seen a
remember,
lot
you
of
have to add
sitting.
the towel.
Right.
Depends
Another-
on the clinic.
Okay.
Yeah.
Now, you
Another
want him
thing
to be
about the
comfortable.
hard pack too that I forgot to tell you guys, never lay this side on the patient. Because if you see, so it would be smarter to lay it this way.
Yeah.
I made that mistake. So here you go. I mean, it's
What
not,
else
I
did you
didn't burn or anything, but my CI called me out and she was like, look, try to do it this way. And then lay the towel like that and then you put this on the patient. So as you
want
see
his
right here,
hand
we have
As
2.
far into the material as
1,
possible.
2, 3, and 4. So you have 6. And then if you don't feel comfortable, you can add another towel.
Question. You count the time that it started
Are
treatment
you nervous?
just from the beginning?
Yeah,
I
what
mean,
else did you do?
just put the whole layers and the back and the patient, you start counting because it's going to take a while
We
until
did
you know
two
the
things.
heat reaches
One, we can move the machine
patient's
closer to
skin.
him, but we can't.
When you guys start practicing, lay on it. Put all the layers and stuff. Lay on it, you're going to start feeling it about after 1 to 2 minutes.
Because the maximum temperature is
So
10
you would have
minutes.
introduced
So
yourself.
Yeah.
starts to
You
warm
would
up.
have explained to him.
And you have to remember,
All we
this
talked
water
about
in
at
here
the
is
beginning.
100 and something
You would have done
degrees.
exactly
So
what you did.
it's really
Correct?
hot.
Yeah.
And these hot packs are
Minus
made
the
to
heat.
contain that heat.
Alright.
So
And then
you're going to start
you have
feeling
chosen
that
how
after a
long
while.
you were going to treat.
Another thing about the
How long
cervical
you were
hot
treating
pack
for?
is that you don't only use it for the neck. So for example, if I have a knee patient, I want to put it on their knee, you're just going to grab it and
So
wrap it
when you
around their
finish
knee.
here, you'll go look at the book and you'll decide
You
how long
could
you want to
use,
treat him
this
for,
is like,
right?
you could use it
And,
for
then we
almost
can
any
slap.
body part.
bony process.
And then
You can use it across.
that's for the, obviously the back, because it's way too big to put that on someone's leg. And then you have a smaller one, which you
You're brave, man.
and then that's pretty
The
much
only
it for
thing,
my
the only thing she's never done this before.